Throughout my professional journey, I have always prioritized the health and well-being of the patient. So I'd like to share with you experiences that demonstrate the benefits of visualized endometrial sampling over blind curettage or biopsy. In this example, we'll take a look at a case that illustrates the benefits of visualized sampling to cause less trauma to the Basalis layer of the endometrium. This patient is a 41-year-old who unfortunately at the time she saw me was a G8P0 with another embryonic demise, in this case a missed AB. She has a history of recurrent pregnancy loss, which had been treated with multiple rounds of sharp curettage and suction DNC. And she has a known history of Asherman syndrome, with having had a hysteroscopic lysis of adhesions 2 years before she saw me. She again presented with another SAB and ultrasound showing intrauterine adhesions and concern for retained products. So she underwent a hysteroscopy with me. The last thing I wanted to do to this patient who had had so many procedures was to leave her, one, with more intrauterine adhesions and another risk for having Asherman syndrome again. Two, having retained products and having to undergo more procedures in the future. And then three, having, the risk for needing additional procedures and coming back again after having such a traumatic experience. So the benefit of doing the hysteroscopy in her case was to avoid any injury to the Basalis layer that would result in more intrauterine adhesions, and also to give her the peace of mind that all of the tissue had been removed and there wouldn't be the chance for having retained products. So as you can see in the video, the hysteroscope is inserted and the MyoSure morcellation device is placed to just remove the abnormal tissue or the products of conception. We're not at all doing anything to the endometrial layer or the Basalis layer, and that allows us to remove all of the tissue without, increasing the risk of intrauterine adhesions in the future.